reform. Republican Congressman, and he's a doctor too, Tom Price from Georgia is my guest this morning. He's also chairman of the Republican Study Group, and he's drafted a health care proposal of his own this summer during your break. Congressman, great to see you. Thanks for being with us.
Good morning, Jamie. Great to be with you.
Just in the last couple of minutes, there is word from the White House press secretary that President Obama will let the American people know what he wants Wednesday night health care. It'll be clear, he says. He also says President Obama is ready to draw lines in the sand. What does that mean?
Well, we'll see what it means, but I hope what the president has taken away from August is what the American people have talked about, and that is that they're concerned and they're fearful and they're angry about the prospect of the government running the health care system. They think that that's not the right way to go. The good news is that there are positive alternatives that we can embrace that'll get folks covered, will address the portability and pre-existing challenges, will make certain that we've got decisions made between patients and doctors, and will address liability, lawsuit abuse reform that must occur. Those are the kinds of things I hope we hear from the president on Wednesday night.
And on the morning shows, there's a lot of talk about health care, and the question is, the American people come to these town halls because they want information. They haven't gotten that many specifics on what the president hopes to have on his desk to sign. David Axelrod also saying this morning that the president believes the public option or government-run health care is good, perhaps not essential, in addition to the White House press secretary Gibbs saying that he will draw this line in the sand. What will the American people take away on Wednesday? Will they know what health care reform will look like, and will it be bipartisan?
Well, we hope it's bipartisan, but if the president comes out and says, look, we must have a government-run option, then I think the American people will continue to express their displeasure and their concern and their anger about the prospect of this administration and the federal government running something that is so very, very personal to each and every American. It's the last thing that we need to be doing, especially when there are positive alternatives that we've put on the table. H.R. 3400 is an alternative bill that we believe addresses all of the challenges without raising your taxes one penny and without putting the government in charge of health care. So I'm hopeful that the president is listening, truly listening, to the other alternatives that are out there, and it's not just an echo chamber within the White House trying to hunker down and figure out how they can put the government in charge.
Just crossing the wires right now, the public option is still in play, according to the White House press secretary. What's your proposal look like? Before we go, what's different about it, and why do you think it's better for the American people?
Well, it does 5 specific things. It says that we've got to get folks who are having difficulty getting insured, and we can do that through the tax code in very positive ways. We've got to make certain that we address the portability issue. You ought not lose your insurance if you change your job or you lose your job. We've got to make certain that pre-existing illnesses and injuries are able to be covered, again, without putting the government in charge. Medical decisions ought to be between patients and their families and caring and compassionate physicians. Lawsuit abuse reform has to be addressed, and we do that in very positive ways that decreases the practice of defensive medicine and saves a lot of money. And finally, and maybe most important, we can do all of that without raising the taxes on the American people 1 cent. Remember that the president's proposal, or the proposal that's come through the House so far, increases taxes by $800 billion and slashes Medicare by $500 billion. That's not what the American people want.
Congressman Tom Price, please come back and let us know how that option that you're going to propose goes. And I know the Blue Dog Democrats, who are fiscally responsible, are also looking for ways to cut costs and get everybody covered with health insurance. Thank you so much.
Thank you, Jamie. Appreciate it.
Okay, Eric?
Well, Jamie, there's some good news out west this Sunday morning.